Highway 50 begins a steady climb into the Rocky Mountains. Healthy living in the great outdoors is a high priority for many in this area. A huge debate going on in this country about healthcare, and a big piece of that is wellness. And in a way, you're an important link in all that.
Just like your grandma said, you are what you eat. And if you're eating over-processed, undernutritious food, you're not going to be a healthy human being.
Mile 2107, Montrose, Colorado, where Jeff Downs is at the forefront of a revolution to change the way we eat.
Everything that's in the grocery store comes out of the commercial factory confined feeding operations. Every steak you ever had spent 3 to 6 months in a feedlot full of manure with a couple 100,000 of his closest buddies.
Owner of Kennecan Heights Natural Foods, Downs thinks most Americans would be shocked to see the inner workings of these mass-scale industrial farms. He says it is unhealthy for us, the animals, and the environment.
Come on, girl, let's go. I think greed takes over. Start talking about units instead of animals. And they start talking about profit margins. Come on, guys. And everything's done from some big office building 1,000 miles away from where the animals are being grown. So there's no accountability in our food system.
Mile 2169, Grand Junction, Colorado. The small city set atop this dramatic stage recently came into the national spotlight for a welcome distinction. It is a place where, for the most part, healthcare works.
Well, how are you going to save money in the healthcare system? You're doing it here in Grand Junction.
The explosive costs of American medical care and the political battle to reform it is setting off one of the most contentious national debates in decades. But amidst our shattered system, Grand Junction is offering what experts say is quality care at some of the lowest costs in the nation.
Chelsea, could I get some help in here?
Community is at the core of Grand Junction's healthcare. 36 years ago, local doctors formed a nonprofit HMO with a system of fixed prices for patients and physicians alike.
There needs to be better organization. The best way to do that is to create microsystems around the country, accountable in the community as far as what kind of care they give, as well as the cost of that care.
Reform starts, says Dr. Mike Permenko, with the awareness of cost.
We sit down and we compare, as peers, who's spending the most amount of money. We look at numbers of how much generic drugs we're using, and we compare that.
1 in every $6 we earn in America goes for healthcare. It is a financial burden for the government, straining employers from corporate to mom and pop alike, bankrupting millions of families. Caring for the uninsured costs the nation more than $40 billion a year. And even here in Grand Junction, there are those who fall through the cracks. You look pretty uncomfortable.
Very sick.
She really is sick. She's stuck. Coming to the emergency room for her medical care, she has nowhere else to go and does not have any insurance.
Has she ever had insurance?
I had Medicaid for a short period of time.
Medicaid.
But it got cut off.